Good evening. Thank you for joining us on Let's Talk Chiropractic. I'm Dr. Russell Hoke. This is Claudine Gallagher. And if you weren't watching us last week, Claudine told us and explained some of the things that she's been involved with in her life that she's used chiropractic for. One of those things was severe low back pain. And I'd like to go over some things as to what we see very commonly causing that kind of low back pain, muscle spasms, even sciatica, with situations in everyone's life that we have, and how we can restore that and take care of that. So we'll be right back, and we'll dive a little deeper into that. Welcome back to the show. Let's Talk Chiropractic. We're back with Claudine. And you said that you had some questions about how that incident with your low back came on.
Yeah, so I just wanted you to explain to me and anybody that's watching, like, what exactly happened to my lower back, just to get more understanding of why it locked up. And is it just it's not just the muscles, because it has to be more than that. So can you go in and explain more of what happened in that situation?
Sure. There's generally a lot of factors that go into that. When we say the back is locked up, it's that the muscles won't relax and contract in a normal fashion. So you get basically no motion. Your low back is paralyzed in one position. To explain it better, let me use a model. And
Okay.
this is a model of the low back. Okay, it's
Okay.
called the lumbar spine. And the lumbar spine has some particular characteristics about it. It has a very large area here. The vertebrae are larger than any place in the spine because they support more weight. The joints are to the side and back of the uh, spinal column. The spinal canal, which is right here,
Okay.
is where the spinal cord travels from the brainstem all the way down to the tailbone. The openings on the side are called foramen, and as long as the top and bottom vertebrae stay aligned, and the disc also forms the anterior or front part of that opening, things work well. Okay.
Okay.
Now, when you twist or turn, these things can come into play, and it's sometimes they close down this opening, and I like to refer to this as a window. They close down that window somewhat, but it's not direct compression, and it's momentary. It's on, it's off. So, when the nerve root comes into play with this, you can see how much space the nerve root takes up in that
Oh,
opening.
wow.
Okay,
Yeah.
so there's not a lot of clearance left in there once you add in their ligaments and tendons and muscles,
Right.
and thereby. And what tends to happen with that is when that's in unison and working well like that, it stays in good proximity to one another and everything stays contained. Sometimes you will get a misalignment of that. Now I'm going to switch from this model to this model
Okay.
because this is the actual model of the low back. This is the lumbar spine. You can see the discs separate each vertebra from L1, the top lumbar vertebra, all the way down to the tailbone right here. The discs separate them, but it also holds them together because it is a specialized ligament.
Hmm.
And the ligament holds those in place and only allows them to move so far out of position. That's generally what ligaments do. They attach bone to bone.
Okay.
The movement of those is done through the muscle. That's attached bone to muscle. Okay,
Okay.
so that's how movement occurs. Here you can see the nerve roots on the sides
Hmm.
occupying these openings all the way down through. What happens sometimes is that you will get a misalignment like this and a wrenching of the low back, which closes down the opening space in there or the clearance. Once the clearance is reduced, even minor movements can cause pain or discomfort. You'll see people walking in a forward flex position, sometimes to the side. You'll see them walking and one hip will be higher. They'll have a tendency to limp, but their legs look fine. It's usually a compensation for what's going on in their low back because their they're favoring that in order to reduce the pain.
Mm.
Okay. All that while, though, they're letting this pot boil because as time goes on, that gets worse.
Mm.
So pretty soon it will become a degenerative condition if not treated, and that degenerative condition will set the patient up for not only recurrences, but possibly even a permanent condition.
Mm.
Okay, so that's how that happens. When those nerve roots are compressed and compressed acutely, these muscles along the spine, this is just one of the very large muscles, it's called the erector spinae muscle, and it's what holds us upright. If we push back real hard,
Wow.
that's what forms that curve in the low back.
Oh, that's
Everybody has this kind of thing in their low back, and that's what they should have. When this starts to leave us, it takes away the strength of the low back, but it also causes the muscles to overwork. And so it takes less to set that off.
Mm.
There's other situations that develop, and sometimes the joints of the spine, which are here and here, that align front to back, top to bottom, sometimes they'll become irritated, called facet syndrome, or they can even start to degenerate and you develop osteoarthritis in there, and that's when you get the spurs and lipping of the bone. An advancement of that is when these pads, these discs that separate the vertebra, start to degenerate. The size of them decreases.
And I was just about to ask about
Yeah.
that, like, because I see that this one is a lot smaller and a different color. So I was hoping that you were going to go into that.
Yes, and it degenerates and gets thinner like that, and that's
Okay.
what will really accentuate those odd movements that you'll see people go through in order to walk. A lot of times I'll walk through the mall and just watch people walk, you know, and have the impulse to go up and tell them, do you know they can be helped, you know?
Yeah.
But that's what happens. That's a long-term condition generally.
So if that, okay, so you basically answered my question if a long-term condition, but can, if it's not to the point where it's too far gone,
Mm-hmm.
can something like this be reversed completely?
Okay.
Or, I mean,
Right.
I'm just curious.
Once it gets to this condition, we can't reverse that,
Okay.
but we can still mobilize it.
Okay.
And mobilizing it means keeping that motion there, keeping it stable and mobile. I think what you probably had, as a lot of people have, was the beginnings of a herniated disc.
Yes.
And this is what the herniated disc looks like. It's where a bubble develops out to the side of this, usually at these windows where the nerve root exits. And when that develops, it really crowds that nerve root.
Nerve.
So motion
Yeah.
is significantly limited.
Yeah.
Yeah,
It's kind of like one of those stress balls when you squeeze it and it has that ball.
exactly. Well, let's take a little break and we'll be right back.
Okay.
Welcome back to our show, Let's Talk Chiropractic, here with Claudine. And we're talking about some of her experience with chiropractic and the conditions that she treated for. So we'll turn back over.
Thank you. So, you know, like I mentioned before, I've been going to the chiropractor ever since I was a little girl. My family's always believed in, like, that's very important. And as different situations have happened, I'm like, oh, this is very important. But I was also in sports, pretty much any sport you can think of, from softball, swimming, soccer, track,
Major
cross
rounds.
I did them all, like basketball, volleyball, everything. And so I took a couple major blows. Let's just put it that way. Especially in softball, you know, being the catcher, people trying to come in and steal home plate. I was not letting that happen, by the way. But had a lot of fun in sports. But, you know, sports comes with injuries, which also made me a heavy believer in, you know, going to the chiropractor.
Right.
But I always had this pain in my neck that, you know, it would start from here and then it would just shoot down to about like right in here. So it was like here to here and it would get so tight that it would start to like burn, and I would always be going like this, and people would always be like, "Oh, you're so stiff." Like if I would go get a massage, they're like, "You are hard as a brick. Like what are you doing?" I'm like, I'm not doing nothing, besides, sports or something like that, but nothing out of the ordinary.
Right.
And they were like, "You need to get that looked at," and I'm like, "Well, I'm going to get, relief." But every time I would go get adjusted, it was instant relief. Or if my dad would just like massage my shoulder,
Right.
instant relief,
Yeah.
to like get that muscle just to relax.
Right.
But I was always so curious. Like, there's got to be something, like, this cannot be my norm.
Right.
And I wasn't okay with, oh, I just got to live with it.
Yeah.
And I was always searching for an answer and asking professionals like yourself for more answers.
Right.
And I finally got that relief. And I'm so happy because I get the chiropractic, I get the muscle stimulation, and I also get the acupuncture and the massages. And that gives me the mobility to live a normal functioning life and not be in pain.
Right.
So I would like you to actually go more into that.
Okay. Let's take a look at the cervical spine.
Okay.
The neck, that's usually what is involved with what you're speaking of. And sometimes it takes a team of doctors to calm things down, keep things under control, depending upon the patient and the underlying circumstances. Have here a spinal model. We'll focus right from here up.
Okay.
The cervical spine is smaller in size than the lumbar spine is. There's 7 vertebrae. It should have a forward-shaped curve like that.
Okay.
So the discs are larger in the front and smaller in the back. And there are discs between each vertebra except the top vertebra and the skull and the first and second vertebra.
Okay, and let's make sure that they can see that too.
Yeah.
So
Now, as far as muscles, muscles attached to all these outcroppings here and lie within these channels up through here for movement of the bone. They leverage.
okay.
They use these parts of the bone for leverage so that they can move the bones. We can turn our heads. We can tilt. We can extend back.
Okay.
In the base of the cervical spine, right here, from here to here, there are a group of nerves that come out and coalesce. They come together and then travel under the collarbone and down into the arm called the brachial plexus. Now, those groups of nerves travel all the way into the shoulder, all the way down the arm, forearm, hands, and fingers. And they control and they have sensitivity to what is happening in those areas. But sometimes what happens is they will trigger or sense that there's increased muscle tone there. If you were the catcher and catching, yeah, you're doing an ordinary thing, but we do it repetitiously, sometimes to the point that we cause increased muscle tone, misalignment of the vertebra. Catcher, that's a poor position to be in all game anyway. Okay.
Right.
But what happens with that is once you compress these nerves out here, they start to follow that track down through and create sort of a neuritis involvement, which oftentimes will even cause the muscle to be overactive. Okay, so it doesn't really relax. So you always have that tight feeling. It's uncomfortable. Okay, you can reduce that with trigger points, with therapy, and with chiropractic. And if we find the misalignments in the neck where they're twisted like this, out of position, or this curve that should be there like that is reduced, that increases the distance here, which causes tightening of the muscle. Okay. So when that happens, we try to restore this curve and try to reduce these misalignments to bring about relief for the patient, but also to take the body back to symmetry. The spine is the midline of the body, and it's left and right handed. So it's like an image in a mirror. If you look at that, the left side should be similar to the right side. You have dominancy typically, like right-handed, left-handed, so that's usually larger. That's usually more active. You rely on that more for reflex and control. But if the spine is misaligned and you have, and I see this all day long, there's curves like this in there. What that does is it typically will cause an imbalance in there. So you can work with your right hand very well all day, but engage your left hand or your left arm and shoulder, or the position that you're at work with, or the position you're at home with. It's going to eventually cause problems there. Yeah.
So, with that being said, I understand the whole being dominant handed and stuff, but how about for the person like myself that's ambidextrous? Does that work in our benefit? Because then you're kind of maybe balancing out and not using so much on one side, and then maybe it doesn't cause as much. I don't know. Like
Right.
that's just
Right.
kind of.
That's a good question, and I have a lot of people who are ambidextrous, meaning that you can use both sides. And I don't know if there's a relationship with that. I still think there's a little bit of dominance to one side or another.
Yeah, I'm definitely more dominant to my right.
Yeah.
But people do catch up. Like, did you just switch to your left? I'm like,
Yeah.
and I don't even realize I did.
Right. Okay, we're going to take a break. We'll be back in just a minute. Welcome back to our show, Let's Talk Chiropractic. We're here with Claudine. We're going to wrap this up talking about how the body is balanced, how the body is supposed to work and sometimes gets out of whack and causes pain, discomfort, symptoms that we think will just go away. Sometimes they do, but they leave their mark, and that oftentimes causes ongoing or recurrent symptoms. You can have problems or issues on one side of the body because it does segment the body in half and have actual symptoms on the other side of the body. That happens a lot in the neck and shoulders. You can have a problem in the lower portion of the cervical spine that gives you pain out into the left side, as Claudine had said.
Yeah, when you said that, and also I've had other people say that, but I didn't know for years that that was actually a thing, that like I'm having pain over here, but it's actually some compensating for something that's happening over here.
Connected to.
Or it could be a little bit of both.
Right.
And it's like, okay, it's just like anything in life, right? A lot of times we like to go to like what we're feeling like it's this, or the surface of this is the issue because this is what I'm seeing or this is what I'm feeling, right? But it's like, no, let's get to the root of it and go a little deeper. Let's go a little deeper into it because this might be something that's happening down here, or vice versa. For example, like I had this really tight, like it's usually my left side, just from playing sports, and then also related to multiple sclerosis and some injuries from sports. That I had my left glute. I was like, it's being a pain in the.
Yeah.
but I just want to keep my testimony, but we all know what I was talking about. The glute was just tight, and it's like, okay, what is going on here? And I was always just looking at the surface.
The spot.
And then it was brought to my attention that after I got adjusted and also got some acupuncture, and there was a release, they're like, the issue's not the glute. It's your lower back.
Right.
And then they're like, and also you have issues in the neck. So it was the whole, what did you call it? The whole
kinetic chain.
The whole kinetic chain.
Right.
And if one part is off, then you're going to start throwing everything else off. But if you get all that lined up, then everything just flows just great. Like gravy or whatever the saying is.
Well, and that's one of the reasons also when patients come in, we do a full spine exam, and we'll start in the neck and work our way right down to the low back. We'll do muscle testing. We'll check your leg length. We'll see how far you can raise your legs. We'll compare it left side, right side, and to normal, because not all of us are normal, okay? But we want to make sure that what we're doing forms a cohesive diagnosis that we can go back later 2-3 weeks and check and demonstrate improvement. That's how patients should respond. They should have marketable changes in that. So that's why we do a full spine exam. As far as the kinetic chain goes, you'll see them in the mall, you'll see them on the street. You know, people walking bent forward,
Mm-hmm.
people throwing one foot out, one hip is higher than another, shoulder higher than another. That could be an anatomical problem, but in most cases, it's a misalignment problem, a postural problem, an imbalance problem, left and right, front and back, top and bottom. So, those are some indicators that you may be a candidate for chiropractic care, and the only real way to find out is to come in and have an examination and determine whether or not there is evidence or proof there that there's misalignment that's affecting that kinetic chain. So, well, we've finished up pretty much the whole spine here. Thank you for being here. Thank you
Thank
for
you.
doing that. And I think you had one other thing you wanted to talk
Yeah,
about. I forgot what that
yeah.
was.
I was just gonna, to encourage anybody that's watching. Don't wait. Just start coming, and you will see the improvements. And don't just look at the surface of I'm having this issue. Just come, get adjusted, and you'll find out. Oh, it was actually this that was causing this issue. And it'll change your life. And I just want to thank you again for everything that you've done
You're welcome.
for me and my family. It's deeply appreciated. And yeah,
Hmm.
and just thank you for having me on the show.
So for now, I thank you for watching. I thank Claudine for coming and spending time with us to tape this, to get this on the air. And thank you for watching.